And today we get to talk to the Warming Center's board member, Nick Aemisegger. So talk with me a little bit, first of all, in your real life, what do you do?
So I am the managing attorney, one of the managing attorneys for the Public Defender Office here in Kalispell. And the Kalispell office was created in 2006 when the Montana Public Defender Office was first created as a statewide office. And so I've been operating in a management capacity more or less the entire time since it was opened back in 2006.
So you're a practicing attorney?
Correct. I am.
All right. What brought you to the Flathead Warming Center?
I think it had a lot to do with what I was seeing in my capacity as an attorney for the Public Defender Office, how much people were struggling who were homeless in this community, and how services had dwindled over time. And honestly, I think that's one of the big stories, John, because we all know when we encounter people on the street, especially people that are acting out, that a lot of folks do have mental illnesses. Some are more obvious than others, but I think the vast majority of people who are homeless are suffering some kind of a mental illness. When I started doing this work almost 19 years ago, we had very robust mental health services in this community. I mean, we really did. If I look back now, I can identify several things that we had then that we don't have now. We had a crisis stabilization facility that was fully operational. We had a full-time psychiatrist that worked for Western Montana Mental Health, whose job it was to serve those people who had mental illnesses that were living in the community, many of whom were homeless. We had case managers who were able to transport people to their appointments to make sure people got medication that they needed. We had a team of highly trained individuals on what's known as a PAC team, including a prescriber who could literally go out on the street and give somebody an injection. You know, we got a lot of people that need monthly injections if you're schizophrenic or you have a serious mental illness. And those people can be hard to find. They can be hard to locate. But we had a team of individuals whose job it was to make sure that folks like that were receiving necessary treatment. And we had other services as well, in addition to Pathways. I think it's called Logan Behavioral Health now. Yeah. But Pathways is the acute behavioral health treatment center here in Montana, but it's not made for long-term solutions, right? You go there for a short stay, and the idea is to divert people back into the community so they could receive some of these other services and then stabilize in the community. Even during that time, we've always had the ability to send people to the state hospital, at least in the last, more than 20 years. And 20 years ago, it wasn't that uncommon for the county attorney to file like 150 of these petitions. It's really a useful tool for any community to have, because when you have people that can't be managed in the community because of their mental illness, you have a place where you can send them for a longer period of time so they can be stabilized. And like I said, I think we had around 150. We had years where we had more than 150 of those petitions filed. And again, it's a very important tool. If you look at where we're at today.
Well, first of all, help me understand what happened to all these services.
Well, a lot of things happened, right? It didn't all happen at once. But I think what the short story is that funding mechanisms changed over time, right? And I think Medicaid, the federal government through Medicaid mostly, and we've got a state share of that we pay as well, but started paying for a lot of those. And so a lot of these services started out with grants that were state funded, both state and federal money that started these grants for bricks and mortar. That's why we've got buildings up there near the hospital that used to have a day treatment. That's another facility that we used to have where people who were mentally ill and or homeless could go during the day, receive treatment, receive food. There was facilities for them. And so a lot of those were grant funded. There were dollars that were available that created, the money needed to build the bricks and mortar kind of stuff. And then Medicaid kind of stepped in. Well, Medicaid reimbursement rates, which are controlled in part by states, were kind of reduced, squeezed over a period of time. And in 2017, I think, maybe it was 2015, that's when case management rates were basically gutted, and most people couldn't afford to have case managers anymore. And so I think a lot of it's funding, John, right? And so it was just harder to maintain these services. Now, some communities have been able to maintain them anyway because local governments stepped in, right? And they filled the gap, and they provided the funding that was necessary to make sure that those services didn't, dwindle and die on the vine.
Yeah.
We didn't have that happen in our community, unfortunately. And so those services were allowed to dwindle and die on the vine. So, I mean, I don't know if that answered your question.
That does answer my question, yeah. So what do we have today to help these folks?
The short answer is nothing. And that's not much of an exaggeration. You've got, the facilities that I referred to, the day treatment facility, gone. The full-time psychiatrist to help people in this population, gone. The case managers, gone. We don't have people to transport. We don't have people who are equipped to go out into the street and administer shots and make sure that people are actually getting their medication, which is why it's one of the reasons. There are many, but I think it's one of the biggest contributing factors to what we're seeing on the streets in Kalispell right now. I think we're seeing more people that are mentally ill. So homelessness is much more noticeable when you have people that are mentally ill and who are acting out on the street.
Well, that helps us understand the problem and why we got to this point. The Warming Center certainly is not equipped to do any of the mental health stuff that you're talking about.
Correct. And I think it's one of the biggest frustrations for all of us who are dealing with homelessness and mentally ill people who are often homeless in this community. And I don't know if you've had law enforcement on the program before to talk about this issue. Yeah. But the frustration I think that they're experiencing as well is they used to have places to go to take people, and they could immediately get them into services and then transition them back into the community. Anymore, that's not the case. They're just picking people up and moving them around. It's even getting hard to get people into the hospital, and I mean like our emergency room department locally, because it's so difficult to deal with this particular population. There's almost this sort of sense that, gosh, I really don't want to deal with that. If I let somebody in my door, what do I do? Yeah. And so it's really hard. And what's exacerbated the problem is the very serious issue we have with the Montana State Hospital, because Flathead County isn't the only community dealing with the lack of behavioral health services. It's happening across the state. I think it's happening across the country. And so what that results in then is the only resource that you really have, which is the Montana State Hospital, being literally overrun. They just don't have the capacity to deal with everything.
Not only that, but they've lost their Medicare, Medicaid
certification.
Yeah. So we can't even send people there anymore.
No. And so, I mean, they are still serving people, but we're not receiving that Medicaid reimbursement, which makes it harder for us to provide the appropriate level of care, and even harder than to expand because we're relying on state dollars, right?
Yeah, we're talking with Warming Center board member Nick Aemisegger, and I guess the next thing we want to talk about is where do we go from here? The lawsuit's behind us. We can forget all of that.
Yep.
But where do we go from here? How do we solve some of the problems you've brought up? And let's do that right after this.
Excellent.
Today we're talking with the Flathead Warming Center board member Nick Aemisegger. So, Nick, you've laid out a lot of problems for us and a lot of reasons why we're having homeless people on the streets. They're not getting cared for. You can take care of 50 a night at the Warming Center, but that's it. The problem is so much bigger than that. But now, what are we going to do? How are we going to move forward?
Well, I think part of it, and it does relate to how the Warming Center was resolved ultimately, right, with the lawsuit and the settlement, is a different perspective. And I think that one of the things I hope that we're learning through all of this is that, this problem is not going to fix itself if you just ignore it. And unfortunately, I think we've been in that posture in this community for a while, thinking somebody else is going to fix this. Or worse yet, if we don't have services, people will just leave and go someplace else. That's not working, and it hasn't worked. And so I think what's needed really fundamentally is a different perspective. I fear, and this is a real legitimate fear that I have, that most people in this community don't truly understand what some of the contributing factors have been that have resulted in what we have today. And so instead, they just see kind of the consequences of it and the frustrations resulted in it. And so I think what we need is a better understanding of the issues and more compassion for people that desperately need our help and haven't been getting it. And I think if we can have that as a community, and I think if our leaders, the county commissioners and the city council and other decision makers in our community are able to kind of receive that from the rest of the community. Hey, we want to meaningfully fix this problem, and we want to spend money to do it. It isn't going to fix itself. And so we need to be part of the solution. And we don't need to wait for state dollars. We don't need to wait for federal dollars. We're going to have to spend some of our money locally to deal with the local issue. That's been something that I think, for the most part, our local leaders have not been willing to do.
Well, taxes are high enough here. I get it. But by the same token, how much money are we losing having people walking the streets? I mean, how?
So, yeah, I mean, that's an excellent point. And how much money are we losing by housing people in jail? That if we could just get them services and get them back on the street, many of them could be productive members of society again. And so I think we are, in the aggregate, losing more money than we're saving by, quote, ignoring the problem because we're spending money elsewhere.
What do you say to people who say, oh, they're just a bunch of druggies?
Well, I say in part that's true. There are plenty of people that are homeless that are drug addicted. No question about that. But a lot of them are drug addicted and mentally ill, right? But even the people that are drug addicted, my response to them is, yeah, they're drug addicted. Does that mean we let them die? I mean, maybe we should try and do something about their addiction. And so it is a difficult problem, and there is no magic bullet. But I think we need more of a compassionate approach rather than, well, let's just be content with people who are mentally ill and drug addicted ending up in jail and in prison because there's no place else for them to go.
Well, you've laid out a pretty interesting picture here today, Nick. One I don't think any of us have really understood. We've just thought these people were lazy.
Well, yeah, and it's easy to do that, right? We had the Guardian newspaper, this is a British newspaper, that came down and did a in-depth investigation and published a significant article on what's happening in Flathead County with respect to homelessness. And, you know, why would they come to Flathead County and deal with the issue of homelessness? It's a worldwide problem. And I think the reason they came here is because we're, unfortunately, an example of how not to handle this particular problem. And so as far as people being lazy, as far as people, being drug addicted, you hear that all the time. I think it's easy to scapegoat people. And that's what's happening in this community. Rather than just really trying to understand what's happening with these individuals on the street and homelessness generally, it's easier just to scapegoat them. Say, well, they're just lazy. We need to get rid of this element, which, by the way, we're not the first people to do that, right? It's exactly the same thing that Hitler did. And hopefully we can learn something from that and not make the same mistake.
Yeah. Poignant, very poignant. Nick Aemisegger, thank you so much for all you're trying to do with the Warming Center, and we appreciate this explanation today.
Thank you. Appreciate it.